this is a large trial, and it recruits patients specifically with non-relapsing SPMS. So in this case, it's defined as it is commonly defined that they don't have relapses 2 years in coming into the trial. And there were various factors. I think the age was just below 50 in mean age. And another variable we're looking at is how many patients have active lesions at baseline. It was 13% in this case. So we think this actually represents a population that has significant unmet need. These are patients that we really would like to treat.
Sorry, Erik. Yes, and just building on that, I had a chance to speak with a couple of neurologists today about that study and about that presentation, and what I heard was this really looks like a real-life SPMS population without relapses. And I think that Erik gave the kind of textbook definition for non-relapsing. I mean, we saw in the baseline characteristics, I think the mean time since previous relapse was 7.5 years. So these are patients who are not having relapses but are progressive. And, if we could show some efficacy in this patient population, that would be a huge advance for the community.
I just want to say one thing about relapses, and it actually applies to the long-term extension data as well, that it sounds easy to count relapses because it should be obvious and we should all record them in the same way. It's actually not true. It's a bit of a technical detail, but we assess them differently in phase 2 trials versus phase 3 trials. Is there a relapse adjudication or not relapse adjudication? So particularly when looking back, when the patient has not been in any study, it may be hard to compare exactly those data with data generated, for instance, in a phase 3 study with relapse adjudication committee. It doesn't take away from the findings. I think the baseline findings are still very relevant. And exactly as Tom said, it really represents the real world and the clinical status. But it's more a technical remark to be careful with comparing different study types with those parameters.